Bring you this story now. Mental health is not just a new discussion in South Africa, and many young people in our country suffer silently on a daily basis without knowing where to get help or understand what they're going through. Motsha Teens is an NGO that helps young people deal with mental health at its grassroots level. The organization currently helps more than 100 youngsters, and to tell us more about it is psychologist and founder of Motsha Teens, Kekana. Thank you very much for your time this morning, and it's quite the initiative that you've started. I mean, I've mentioned briefly that we've got a bit of a crisis in the country when it comes to recognizing issues of mental health issues, but the biggest motivators that drove you to establish this NGO?
For me, it was observing what's happening in our communities and how people are dealing with the realities within our communities. And when I'm talking about the realities in our communities, I'm talking about the exposure to poverty, the exposure to substance abuse, the exposure to violence and unequal opportunities in education, in business, and in the employment sector. So all of these have a toll on adults, and adults are also later on passing it on to the children and creating pressure on the mental health, and also the discussions that we are not having in our communities about mental health, identifying mental health, because I know there's a lot of stigma, there's a lot of taboo around mental health, and we don't have even our African names to define these mental health issues, where we've always defined it as buloi or as somebody just being crazy, whereas there are different dynamics to it, and some can go treated, and whereas others, when they go untreated, then it becomes problematic, in the type of quality, the life that you want to live, the type of adult that you become, and you later become a danger to yourself and to other people around you. So it was surrounded around that, where we're saying that we want to bring information to our communities. We want to open a dialogue where we can openly discuss mental health issues, identify it at an early stage, and later on seek the help and in the correct manner, because with some mental health issues, it's not only about talking, but you need to be on some medication, So we need to understand what we are going through so that we can find the right help. So as a psychology graduate, I started this NPO so that we can assist young people to mitigate the issues that are causing young people to commit suicide, the issues that are causing them into severe depression,
Yeah.
So that is why we are out there on a drive to ensure that young people have the right information and they're treated as early as possible.
No, absolutely. I mean, you mentioned the dynamics of mental health illness and that there are many of those. Maybe talk us through some of those dynamics so that we get a better understanding of what it is we're trying to tackle here.
Okay. There's a dynamic, there's personality disorders where it affects the mood swings. There's anxiety, there's stress, there's depression that requires you to speak up and be on a program that you can tackle and confront your issues. There's different like schizophrenia, where you need to be on a medication in a mental institution, which the current problem we're facing is that it's not easily accessible for young people. We've got bipolar, where it requires you to learn more about all these different things so that you can approach the correct channel to get assistance. So the biggest crisis right now is that the young people don't have access to the information about mental health, and there isn't enough facilities to assist these young people.
That's such an important, I wanted to bring that up, the resources, access to the actual help when you need it.
It's not easily accessible, and sometimes it's expensive, it's not available on a daily basis, and young people are suffering from this on a daily basis. It's not a matter that you can switch it on and off. It's something that is continuous, that's going on a daily basis. So yeah, that's why we are out there trying to strengthen Motsha and stretch it out for more young people, more communities, so that they can be able to get assistance. And in this drive, we are also reaching and pleading out to government institutions, to our corporate partners and other young professionals to come and partner with us so that we can be able to assist these young people spot on. We are on a drive to build a facility in our community as well, where we don't have to reject young people because we don't have resources and we don't have the manpower to support them.
Yeah.
So
no,
trying
that's
to
very
bring
interesting.
it to the community.
No, absolutely. Talk us through those communities that you are targeting.
Okay. We're currently based in Ratanda, but we want to stretch out to the areas around us, because there's a lot of rural areas around us, and also also in the East Rand, we do get calls a lot, and we have to, like, unfortunately reject those people because we don't have the capacity to support people outside of our current environment. So that's why we're just on a drive to ensure that we can attract more people that can align with us within their community improvement projects, where they can partner with us, and then we can stretch this nationally as well. And to
Yeah, how easy or how difficult was it for you to get young people to come and learn about mental health illness and engage with the programs that you are offering them? Because you did mention earlier there's a big stigma around it, so it's probably not easy to get people to come on board, not only to learn about themselves and how to deal with it should they be suffering, but also how to deal with those around them that may have similar issues.
It was very difficult. You know, when we started for a period of about 2 years, we didn't get support because people were having their private discussions on the side on what is she trying to do? You know, what information is she trying to feed our children? You know, because in the home environment, they grow up being told this is what it is, and you are coming with different views and different perspectives to say no, it's not witchcraft. They are not crazy. You know, they are going through a medical condition that needs medical attention. So having those discussions, we literally started with about 5 people when we started, because with mental health issues as well, we also focus on personal development, you know, where we're saying you as young people, you need to challenge yourselves and change your mindsets in order for you to be able to break the curses within the community. Because when you look at our communities and how they are structured, is that everyone is fighting for survival, you know, and the young and old. And because we all have a different and conflicting ideas on what that survival means, and that is where it's the grassroots of the problem, because now we're having people in our communities that are fighting for survival, but they are willing to operate within the boundaries of the law. Then we've got other people that are willing to do just about anything to survive, and that is where our social ills are being that's where the sorry about that. That's where the social ills are coming from, because now our young kids are exposed to drugs, they are exposed to alcohol, they are exposed to sexual activities in return for sex, just for survival. And then we have the biggest way, it's unequal opportunities in employment, in the business, and in entrepreneurial as well, and having unqualified people in positions where they can't represent young people. So those issues, they also take a toll on the mental state of a young person.
Yeah,
so it's not really only about mental health. It's what's happening around us that we need to start having discussions and bring solutions driven, so that we can try and resolve those issues that our young people are facing.
Thank you very much for your time. Very interesting conversation, and I wish you the very best of luck. Important work that you and the relevant stakeholders are embarking on.